safety dispatchers, and a host of other professionals that work in the emergency services world. It's a phenomenal facility, and as we go through the program, I hope that you are attracted to coming out here and joining us to become an EMT. A little bit about myself. I spent 30 years with the Elgin Fire Department. I retired as the chief in 2016 and was fortunate enough to come out here for the grand opening and have been here working with all my adjunct instructors and our staff at main campus to bring the best EMT training to you. With that, I'm going to let Lieutenant Strasner introduce himself before we get into the program, so you know everybody that's on the chat here with us this afternoon. David?
Hi, I'm Lieutenant Dave Strasser. I've been with the West Onion Fire Department for 27 years. I started my career as an EMT student at ECC in 1991. And right after I got out of class, I got on a private ambulance. And I've been on an ambulance now. Come this January, will be 30 years I've been on an ambulance. So I've got a lot of experience and, again, got my start here at ECC.
All right. I'm going to swing back to me real quick, and we'll talk about why or who might want to become an EMT. That's a question we get asked quite a bit. Well, why do I want to take the EMT class? How would that help me move forward in my career dreams, my aspirations in life, and things like that? So there's a whole host of reasons. I'll start with the number one. If you want to eventually become a firefighter and serve our community with any of the surrounding fire departments, the basic starting class is EMT. Well, we see a lot of firefighting stuff on TV that firefighters are going out fighting fires all day long. That's really not the case. The case is that most firefighters spend about 75% of their time answering medical emergencies, working as an EMT or a paramedic or a first responder, emergency medical first responder on either a fire engine or an ambulance. So firefighters are a big group. If you have any aspirations of learning about the firefighter field, you need to start with EMT and see if that's what you like. We have future nurses who take EMT just to get into the medical field to see, hey, is this what I want to do with my career? We have CNAs, certified nursing assistants, who maybe want to work in a nursing home or they want to work in a hospital setting. Having that EMT certification puts them to the top of the hiring list. And then even in higher degrees, we have people that come through our program all the time that are going to full-time universities, and they'll come here in the summer and take our summer course. It's a condensed course, but they'll take it because they're in a physician's assistant program at university. We have police officers who take our course because they're first responders too, and they want to know what to do in a medical emergency before the paramedics or the fire department arrives. We got people that are in the industrial safety business where they're working in a big factory. You see these large factories and distribution centers like Amazon. There's a giant one in Elgin. They want people on staff who have EMT skills, who can apply that basic knowledge, that basic skills to stabilize the situation, to activate the emergency response system, and then keep care on that patient until the professional paramedics and EMTs come. So there's a whole host of other reasons, and I think Lieutenant Strasser is going to share with you. We even have doctors that come through our program. I'm sorry, doctor students. They come to our program, they get clinical hours, they work at the hospital, they work on an ambulance, and they go on to their careers to become medical doctors. So there's a whole host of reasons professionally of why you would want to be an EMT. But I also want to mention that just personally, if you take this EMT class, it's a state certified class. You'll earn a state certification, but you will learn skills that you will use the rest of your life. You'll learn skills that if you're out on a camping trip and somebody falls and breaks a leg, how to stabilize that leg, how to keep pressure on a wound, how to splint an arm. You'll learn all them skills, how to do CPR. And they're skills that will be valuable the rest of your life. I became an EMT in 1986. Yes, that was a long time ago. I still use my EMT skills today. If somebody falls, gets a cut, if grandkids are over and somebody comes in bleeding, I know how to clean that wound. I know how to apply direct pressure. I know how to bandage that wound. So the skills you learn in EMT, no matter what you do in life, are skills that will benefit you for the rest of your life. I'm going to let Dave chime in a little bit. Lieutenant Strasner. Lieutenant Strasner has been an adjunct instructor here for 10 years. He's a full-time lieutenant with the West Dundee Fire Department. As all our adjuncts are practitioners. You will learn, not from just professors, but you will learn from people who are actually out in the street doing this every day. People that are riding engines. You'll hear about a call or you'll read about a call in the newspaper, and your instructor will have some knowledge of that, some knowledge of how that call went, what happened, because the instructors do it every day, and then they come here and they pass them skills on to you when they teach our EMT class. Lieutenant Strasner, why don't you tell them a little bit about why they should take the class?
Well, for me, I was in a field where I was going nowhere. I mean, I was a union forklift driver, and I just knew that's not what I wanted to do. And I went to ECC to get my start. And I thought I'll take an English class because get that out of the way. My hardest subjects first, right? Most gals have trouble with English, so I'll get that out of the way. Well, it was full for the night class, so I turned the next page, 2 pages over, and there was firefighting EMT, and I'm like, holy cow! I always wanted to be a paramedic firefighter when I was a little kid. That's what I told everybody I wanted to do. So I'm like, man, this is awesome. So I took the class, and once I got into class the first day, I loved it. It was awesome. I mean, from the first day, you're all of a sudden the instructor that we had at the time just got us really interested in it. I was like, holy mackerel, this is what I want to do. And that's all I could think about in class, learning about all this stuff. I'm like, man, what kind of calls am I going to go on in my career? And so I believe that being in the position that I was in now, helping out as the instructor, I can bring that passion to you guys as students. I'll tell you, it's a dare to be great kind of job, and it's not like any other you'll ever encounter. You figure you work. If you're on a full-time fire department, you work 24 hours on, and you're off for 2 days. Now, in that 24 hours, you might get up in the middle of the night. You might get called out when you're having dinner. So the job is always there as a career. But as Chief Fahey said, is that when you're off duty, I mean, in my family, I'm the closest as a paramedic that my family will have to a doctor. So I have my mom call me about my grandma. Hey, grandma's not acting right today, or this is going on. What's happening? So you're going to be in your family. You're going to be the one that people are going to go to ask for help because you're a paramedic. So it's kind of nice to have that. Or if you're at a ball game or something, and someone says, "Oh, hey, so-and-so's dad's a paramedic. Come on over here and take a look at this girl's foot that she hurt." So you never know when you're going to get called to use your skills. But ECC EMT program will train you for that, and it's a basic level. But when we say it's a basic level, it's EMT basic. Now, if you were to go on, then you become an EMTP, Emergency Medical Technician Paramedic, and that is also offered through ECC and Sherman Advocate Hospital. So this is a basic starting stone, but once you leave this class, you can get a certificate from the state of Illinois, and it's a national registry. So if you don't want to stay in Illinois and you want to go to, say you want to go to, Colorado, you can use that license there also and be an EMT in that state. But it's a national registry now, and you can go out and get a job. So it's not one of those, this isn't, a class where, you have to wait and get a 4-year degree and maybe apply for an internship or something. You can actually go out and get a job with what knowledge you're going to get in the class that we offer at ECC. So that's awesome, and it's again rewarding. And so if if you're thinking about it, nothing's greater than helping somebody out and get the rewarding feeling of being compassionate and using your skills that you learn to help somebody in an emergency situation. All right. Any Chief Fahey, back to you.
Yeah, thanks, Dave. Thanks, Dave. Just to kind of hit on Dave's point, we do a career day every EMT class, and employers they'll call me and say, how many people do you have in class? When can I get in to talk to them about coming to work for us? I've got a list in front of me who was at our spring 2020 career day. We had Elgin Medi Transport, ambulance company in Elgin. We had Sherman Hospital come talk about EMTs working in the emergency room. We had Amita Health or St. Joe's Hospital come talk about working in the hospital. We had the South Elgin Fire Department come talk about how EMTs can apply to their job. We had the Village of Hanover Park come to talk about how EMTs can come apply for their positions on their fire department. We had ATEC Ambulance was here. We had Superior Ambulance, and we had Elite Ambulance. So they're employers who are seeking out our students even before you've signed up for class. So getting a job once you get your state license is not an issue once you go through this class. But let's talk about going through this class and what this class is all about. This is an 8 credit hour class. So imagine that if you took a math class and an English class and a science class, that would be 9 credit hours for them 3 subjects, 3, 3, and 3. The EMT class is very intense. A lot of didactic information is going to be delivered to you. It's going to be an intense reading course. It's going to be an intense lab course. So all of these things, when we put it through the system, show that you would earn 8 credit hours for that. So our advice to our EMT students is don't load up with 3 or 4 other classes. Concentrate on your EMT class and do the best you can in there. And that will make you instantly employable, plus put 8 credit hours towards your degree if you decide to go on for a degree. So keep that in mind as you're looking at EMT class, that it's a very intense class. There's 5 different ways to get into our EMT class. I want to take a brief moment. As you guys go on the website, you'll see there's prerequisites required. And there's 5 different ways to meet that prerequisite, and we'll go over them real quick. The first is you can go to the ECC Testing Center and take our PSB HOA, Health Occupation Assessment Test. And that's a basic knowledge test, so don't be intimidated by that. It's a vocabulary test, it's a spelling test, it's a little bit of math. It's just a basic vocabulary test. And that test will say whether or not you'll be successful if you dive right into the intense EMT program. And if you don't take that test, you can also join our Icaps program. Our Icaps program is a special tutor-driven program where a single tutor will be assigned to the class, and you will meet an hour before class. You'll go over everything that was taught in the last class, and what was on your homework, and then you'll come into class and take your regular class. You have to sign up and commit to the Icaps program early on and during registration, but that is a fantastic program for somebody who's really wanting to get through this class their first time through. And the other benefit about joining the Icaps program is they will provide you with your books and materials for free. So you'll get a $60 or $70 book to use for the class, and it's one less expense on you as a student. Another way to get in is if you were a former student of our FSS 215 or our EMT class. A lot of people go through the course twice because they didn't know what to expect getting into it, and they don't do as good enough. You have to get an 80% or better to take the state test. They might have got a 75%, so they're going to go through it again. Their second time through, we know that they know what to expect. So that's why that would satisfy your prerequisite. Another way to get into the class is if you take this semester, if you were to take our emergency medical responder class. That's our FSS 115. It's a certified class through the state of Illinois also, but it's not a yearly or a quarterly recert. You earn that certificate, and you earn that certificate for good. But that class is EMT light. It's only 3 credit hours, and it goes through a lot of the basics to prepare you for the full 8-hour EMT class. Now that class is new. That class will run this semester. We have a lot of students, especially high school students, that just getting out of high school, they've never been in the college setting. They're going to say, you know what, I'm going to take this basic EMT medical responder class to see if I like it and to see if I'll be successful when I get to EMT. So that's the fourth way. And the fifth way is instructor consent. Instructor consent would be you either contact myself or Lieutenant Strasner and you say, hey, here's my situation. And again, I think we told you that we've had people that are in the track to go to med school. They'll come in and say, I go to the University of Illinois. I'm in the medical program there. I want to get my EMT certification so I can do clinical time at the hospital during my education. Well, we look at his record. He gets instructor consent to come in. So again, don't be intimidated by the prerequisite requirement you see when you go online. Take a look at them. Think about going in and taking that PSB test. Don't be intimidated by that. That test is just going to give you a general assessment of whether you should jump right into the EMT program or you should maybe take the emergency medical responder so you can be successful. Remember, guys, as ladies and gentlemen that are listening, remember, this is a marathon. It's not a sprint. It's not as fast as you can get it done and get out there. If this is the career you're choosing, you'll want to take your time, do it right, be educated for the long term instead of trying to go through it and struggle. So there's 5 different ways. Do not be intimidated by that prerequisite, but feel free to call myself. And Lieutenant Strasner, why don't you chime in on that instructor consent and the prerequisites a little?
Okay, so a lot of times, a lot of people will contact me and say, hey, listen, I'm thinking about the EMT program. I've taken other classes. I started down a career path. I had biology. Well, that's a good course to start with. So, I mean, if they've taken a biology course in college, successfully passed it, then yeah, I could go ahead and give you consent to join. So I look at what you offer, what you bring in. I've got a good idea of areas where students have struggled with the class in the beginning, and so now I can tell you, hey, this is going to work, or you might want to think about taking that EMR or taking another class to prepare you for it. But for the most part, this is a tough class. It's a very grinding class. The beginning is going to be really difficult for some people because it's a lot of studying. You got to do a lot of reading. All right. And that's one of those things, areas that, I mean, even I struggle to make sure that I can focus on reading stuff because it's like, oh yeah, I don't have time to read or this, that. And, so you can't be lax about it. The first half of the class is very, very intense. And then the second half of the semester, it kind of smooths out because all the basics are out of the way. In the second half, you can, if you think about it this way, the first half we're going to do medical. And medical, people have to tell you what's wrong with them. And that's not always easy for us to decide what path we want to treat that person. So medical is what you have to figure out. But trauma, if you think about that, is something you can see. You can see if someone's got a broken arm. You can see if someone's got an amputated finger. You can see if someone's got a gaping wound that needs stitching. So you can kind of, or basically, you can also look at the way the accident happened. How much damage is done to that car. So you kind of get an idea what part of the body is going to be injured. So trauma is one of those ones. So once you get the basics down the first half of class, second half's easy. So I'm going to tell you, it's intense the first half, but then it kind of really smooths out the second half. For most of the students will find, and you can probably talk to other people that have taken the class, like, oh yeah, definitely second half of the semester was easier than the first half. So that's most of the time that's where students will get study problems is at the beginning of class. Hopefully that you got to come into with that mindset that it's going to be some work. It's not an easy. You don't just hand out certificates. You state certified class or national registry. And national registry is real intense on making sure that you know the material when you go for your certification test. So we'll prepare you for that. That's one of this class. That's why this class is an intense class. We'll prepare you to take that exam. And if you do the work and we do the work that we're doing to provide it for you, you'll feel so comfortable when you go to that class. Most people have gone to the test, sat in the state exam, they're like, wow, I was so think it was going to be more harder than it was. And it was like, whoa, wait a minute. You guys had us really prepared for it. So one of the things that you have to do is you have to bring your A game, and we'll bring our A game, and you'll have no problem taking that state test. Back to you, Chief.
Thank you, Dave. You have some good words there. But hey, believe it or not, time flies when you're having fun. So I want to get to a couple more things before we run out of our 30-minute session here. But let's talk about the class format, right? We're all living in the COVID-19 world, and everything isn't going to be in person. There isn't going to be a tight-knit group for all our classes. We've developed a special hybrid type of class for this EMT class, where you're going to learn online, both synchronous and asynchronous. And what that means is synchronous means the instructor will be on with you live, just like we're talking right now. And you guys are going to be able to look at each other. You're going to be able to ask questions. You're going to be able to put a face to a name and then and ask your questions and have your learning take place that way. Then there's going to be some asynchronous time where the instructor will say, okay, go over these 3 chapters, review these PowerPoints. We work on a system here called D2L, Desire to Learn. You'll be working with that system as well as with Zoom and Google and Google Meets and things like that, depending on the instructor's choice. And then you'll come back at the end of class for maybe a half hour. Okay, did you guys read this? Did you guys work on this? And then the instructor will again deliver that information live to you across the internet. And then on Saturday, or I'm sorry, Saturdays is my firefighter class, but then on lab days, you will come into the college and we'll use all of the CDC safety precautions. We'll mask up, we'll glove up, we'll have face shields for those needed, and we'll review the skills, the manipulative skills that you are learned in your chapters, whether it's in trauma, whether it's holding C-spine traction, whether it's splinting a leg, whether it's controlling bleeding, whether it's learning how to properly bandage. You'll actually come into class and do that live in person with your instructor. So this is a blended class. We use the term hybrid class here, where you're going to have live video instruction. You're going to have video instruction on your own on D2L type of thing, where you review, and then back to live. And then for all your skills, all the manipulative drills that are required to be taught will be done in person. Dave, you helped develop this system. You helped build this. Why don't you tell them a little bit about your expectations of how that this class is going to be delivered?
I think this class is going to go well. You're going to have to, as students, you're going to have to be the ones that, you know, put forth the effort to make sure you come to class, make sure that you're logging on, and getting the work done. But other than that, you're going to find that it's going to be, I think this is going to be a very successful program, doing the hybrid. We've worked on the ideas, and once we, you know, you figure if you're going to be an EMT, you're probably going to be introduced to more dangerous viruses and whatnot than the COVID. When I first got out on the ambulance, I was transporting people at the height of the AIDS epidemic, where people were dying of AIDS. So we had AIDS patients, and you think about back then, that was, and for those that remember that era, it was a lot of people very scared of that virus. Hepatitis A, another one you're going to be exposed to. And then, of course, the little ones, like you don't even think of. Like, I've been to the hospital, and someone's like, hey, you remember that little girl you transported last call? Yeah. Well, she tested positive for bacterial meningitis. So you guys got to go get tested. I'm like, what? Yeah, I mean, meningitis is a lot worse than COVID. So think about some of the things you're going to be involved in. So if you're a germaphobe, you might be a little leery about taking the class, but proper PPE, which you're going to learn probably the second day of class, is going to be one of those things where you're going to be, so you'll feel totally comfortable coming to a practical and not have to be concerned about. We'll follow the same guidelines. It'll be taught the same guidelines that the paramedics on the street are doing right now. And it's changed so much over the last 3 to 6 months about what we're doing. It's amazing to see the changes we've had, but now we've got it down streamlined, and you'll be totally safe coming to class and doing your practical. So if you're concerned about that, that might be a question people are going to ask. Other than that, it's going to be, I'm looking forward to it for me because we've done a little bit of a hybrid at the end of the semester, last semester, and it worked out real well. So hopefully you guys will decide that this is what you want to do. Chief?
Well, thanks, Dave. Yeah, so let's go just a quick review. If you have a desire to help others and you have a desire to get into the medical/emergency services field, EMT is the place to start. Our course is going to be delivered via D2L and Zoom, asynchronously and synchronously with your instructors, as well as in-person labs. In the end, if you pass with an 80% or better, you get the opportunity to take the national license test now. It used to be the state of Illinois. We've moved to the national license test. With that license, you are instantly employable. You will be offered a job before you leave campus if you pass the test. Those employers that come every year ask me, please do not let us miss your next class. We need people. So the opportunity pays pretty good. You start on the lower end as an EMT, but you work your way up as you go through your career from EMT to paramedic. And if you become a firefighter or a nurse, you build towards a higher compensation. Our class is going to be probably somewhere around 20 students, so you're going to get a lot of individual instruction. You will get to know your instructors very well. That's one of the benefits we have here. Again, don't be afraid of the prerequisites. Take a look at them. See which ones you want to challenge. Always call myself or Lieutenant Strasner or shoot us an email. We'll get you emails if you need that. And we'll see what we can do to make you successful. Our goal here is to keep you safe, make you successful in your career choice. And if this is your career choice, we want to take that marathon. We want to take it nice and slow in the beginning. And so at the end, you've got what you set out to attain. And with that, I'm going to just kind of let it finish up here and see if there's any questions that Jeremy or Monica have come up with from anyone in the audience.
Well, feel free to join in and ask some questions if you have one.
I did add my contact information to the chat box. So if anyone has specific questions about maybe where they're at in the admissions process, you guys can reach out to me directly and I can kind of coach you on at least making sure that you've met the admissions requirements. So please don't hesitate to reach out to me directly regarding that. So we do have a question from Diane. Let me see here. Yeah, I guess she has a question about the passing grade for the PSB.
Okay, so our PSB passing grade to get into the EMT program is you have to finish your test within the 12th percentile. So it's not a super high level, but that just says that you're in the top 12% of people that are taking that test. Again, it's a basic test. You can take it twice if you want. If you take it once and you don't do as well as you wanted, challenge it again. If that's the route you want to take. It's the 12th percentile is the passing grade for that.
One thing about the Icaps is that's another route too that the chief mentioned. Icaps is really good. You'll meet before class with an instructor. Actually, one of the adjunct, and that person will go over how to be successful in class and some of the stuff. So while they're doing how to be successful in class, we'll also go over some of the material that we'll be covering or have covered. So it's another way you can do real well with this program. We've had very good success with our students.
Yeah, I couldn't agree more with that. The Icaps program fits every demographic of student that we have, whether it's an adult returning to change careers, whether it's somebody who's in their career right now and they want to learn additional skills and haven't been to college in a while, whether it's the high school graduate who's just coming to ECC for the first time, or whether you're a student here with a fairly heavy load or fairly heavy family commitment, Icaps understands all of that, and they understand how to make you successful when you're living in that environment. So,
also, English is second language, another one that we've had struggled with students in the past, and that was one of the things when we brought that in. We've seen those students that have English as a second language have done real well.
Yeah, and on that story, I'll tell you, we had a couple semesters ago, we had a young Hispanic female. Her English was marginal. She knew that. She signed up for the Icaps program, and come to find out, we found she was a doctor in Mexico at one time, and she was coming to the United States as a citizen now and had to restart her career, and she started in our EMT class, and she's going to go on to med school here. Are there any other questions, Jeremy?
There was a question about what is the difference between what an EMT does and what a paramedic does?
Okay, good question. So a paramedic is an advanced level. So EMTs, there's a whole scope of practice set forth by the state of Illinois. As a paramedic, though, paramedics can start IV, paramedics can push medication, paramedics can monitor and interpret cardiac rhythms, and they can also do some different procedures, such as a surgical crike, where they'll cut someone's throat and insert a tube to allow for breathing if the airway is compromised or crushed. And they can do IO, interosseous IV. They can actually take a drill and drill into your bone in your shoulder or in your tibia, and give you IV medications that way. So there's different scope of practice. That's not what EMTs do. EMTs can do, there's a list of like 7 medications EMTs can give, starting with like Tylenol, aspirin. They can give nitroglycerin, Narcan, which you've heard of Narcan through for people who might have overdosed. So there's different medications. They can give oxygen. They can do a lot more in the state of Illinois than the rest of the country. So basically your advanced skills or paramedic skills, and your not so advanced skills will be your EMT. And then your EMR is even below that. So there's things EMRs can do that EMTs can do, and there's stuff that EMTs can do that paramedics can do. So it kind of crosses over all 3 levels, but paramedic is the highest.
So Dave, let me chime in real quick for Diane. Diane, your question is really relevant. First and foremost, you cannot become a paramedic in the state of Illinois unless you're already a licensed EMT and have worked at least 6 months in the field. So it's a stepping stone. And in layman's terms, I like to tell people, it's similar to when you go to your doctor's office and the PA or the physician's assistant comes in, and they can only go so far with their care to you before the doctor has to come in, and whether it's to prescribe a medicine or to look at it something a little bit deeper because he has a higher level of education. Same exact thing in the EMT world. EMTB basic has a certain set of skills they're allowed to do by law, and EMTPs have a greater set of skills that they're allowed to do by law. But always keep in mind, if you have a student or someone that wants to become a paramedic, they must be an EMT basic before they're allowed to enter any paramedic program.
If she would email either you or I, we can send her a scope of practice from the state of Illinois of what EMTs and what paramedics can do. So,
all right. Well, we're about 10 minutes over almost. So we got any more questions, Jeremy?
So for those who are on Facebook Live, I want to provide my contact information. I am Jeremiah Wright, the recruitment coordinator here at ECC. I know you guys may not have access to our chat box here. So my direct email is JEWRIGHT, so JE Wright @elgin.edu. And my direct phone number is 847-214-7294. So if you have specific questions about where you are in the admissions process, please reach out to me directly and we could go ahead and point you in the right direction. So I thank you all for giving us your time today. And if anyone else wants to chime in, feel free.
We
I
do
guess
have one more question out there.
Okay.
Chief, this question is for you. How long after the class is completed can they sit for the national boards?
It takes about 2 weeks to get all the paperwork in. We're governed by the Illinois Department of Public Health, our program is. When our students finish the test, the instructors then compile a list of all the students who scored 80% or higher and are eligible for the National Registry Board. And they get that list to me. We get it to Sherman Hospital. Sherman Hospital, who is our overseer, okays them to take the boards. But usually 2 weeks, 3 weeks at the most before they can sit. And we encourage our students to do it immediately. We don't want that lost knowledge. We don't want someone to say, I'm going to take my boards, you know, in spring, or I'm going to take my boards 3 months after class. We encourage our students through the entire class to, hey, as soon as you're eligible, get in, get that test taken. So I hope that answers it for you, Yolanda.
Thank you, Chief. And Chief, can you please give the contact information for you? They're not able to see it live on Facebook right now, so if you could let us know your email contact information as well as Lieutenant Strassner, that would be great.
Sure. I was going to leave everything go to Jeremy instead of trying to inundate our guys with all the emails, but I'll give you mine. It's J Fahey, JFAHY @elgin.edu. That's my email here at the Center for Emergency Services. My phone number here is 847-886-5398. Email or a call, we can answer any further questions you have. Dave?
Yeah, I was just on Facebook Live too. I just put my email on
Great.
Facebook Live in the comments there. So it's
Okay.
it's out there.
Well, with that, I want to.
One more question, Chief, from Tim. Would like to know, who do they email in regards to Icaps?
They can email me, and then I will get them in instead of giving out 15 emails, I'll get them in contact with Elizabeth Hobson, who runs the program. But if they're a student, just shoot me an email, say I'm interested in Icaps, and then I can get it to Elizabeth Hobson, who runs the program. And I think that would be the smoothest way. Okay?
Sounds good.
All right. Thank you all for joining us today.
Hey, wait a minute. I just got a correction on chat. It's Elizabeth Soderquist, not Elizabeth Hobson. There's a bunch of Elizabeths at Maine. So again, that's why if you email me who you're looking for Icaps, we will we'll get all that information to you.
And Elizabeth's son was one of our star pupils. So
That's right. So, all right. Well, thank you everybody for their interest here. We hope to see you at Elgin Community College this fall. Again, remember, this is a marathon, not a sprint. We'll get you to where you want to be. And ECC has got a lot of commitment to this community. So thank you all for chiming in, and thank you all for facilitating this informational session.
thank you.